For those of you who have been to the live Ohio Problem Gambling Conference, each year we are able to listen to and hear from the leaders of all the departments that are so critical for us with Ohio for Responsible Gambling. And we wanted to make sure that this year was no different, albeit we can't be in the same space, we can be in the same place in terms of this virtual environment. So I realized earlier on that I didn't remember to mention who I am. So I'm Derek Longmire. I am the Executive Director of the Problem Gambling Network of Ohio. And the face of PG&O has changed a lot over the last year. A year ago, Mike had been on the job for all of a month. And now we've increased our 2 additional staff, increased by 100%, adding Corey and Cheyenne. So thanks to the great team for all the work that we're able to do this year. Certainly could not have had a 24-session virtual conference this year without all the great support of the full team at Problem Gambling Network of Ohio, and with the full support of all of our great partners at Ohio for Responsible Gambling. So we'll first begin with Director Lori Chris. Lori, over to you.
Thank you so much, Derek, and good afternoon, everyone. I am Lori Chris, Director of the Ohio Department of Mental Health and Addiction Services, and addressing problem gambling is one of our top priorities at the department. We have a team that's expert in this work and recognized nationally for their leadership, and so grateful for them and for the opportunity to be one of the sponsors for today's event and for this month of exciting learning and networking opportunities. So thanks, Derek, for having me here today to help welcome everyone back. It is our pleasure to welcome everyone to the 18th Annual Ohio Problem Gambling Conference. And it is a virtual version. We're used to being together and getting that networking time, and I know that you've built in opportunities for that. We are honored to bring you these experts on prevention of problem gambling, clinical care for gambling disorders, and ongoing supports for recovery as well, recognizing the importance of that full continuum for the problem gambling space, like other addictions as well. In fact, with 15 individuals in recovery joining us at this conference, we know that we can all share in their lived experience, their strength, their hope, and benefit from their knowledge of recovery and the strength that it takes and the strategies that it takes to achieve that on an ongoing basis, on a daily basis. I also want to thank our co-sponsors and partners, Ohio for Responsible Gambling, of course, the Ohio Casino Control Commission and Executive Director Matthew Schuler, and the Ohio Lottery Commission and Executive Director Patrick McDonald. We are so grateful to have partners who are as engaged and caring as you are about responsible gambling in Ohio and supporting those who may have a need for treatment and recovery as well. And we shall thank the Problem Gambling Network of Ohio and an incredible team under the leadership of you, Derek, for pulling this conference together for all of us. So thank you so much. We are marking a year unlike any other, and we've seen incredible changes in our lives, and the pandemic has forced us to stay home and to value the homes and families that we have. And not everybody is having the same experience. We like to say we're all in the same storm, but we might be in different boats. So we do recognize that this pandemic has hit everyone a little bit differently. And for many of us, it's given the opportunity to learn new skills, to spend more time with family, maybe to watch a little more TV. I know I have, read some books, discover new ways to spend our times. And for many Ohioans, those new hobbies may include new ways to gamble. And so that's what we're here about. We know that gambling should be fun and entertaining, but we also know that those joining this conference recognize that sometimes gambling isn't fun and it can be too much money spent that won't come back, too much time away from a family or a job, too much temptation to keep gambling despite negative consequences. And in our field of behavioral health, mental health and addiction, we know that this situation is a problematic, potentially even diagnosed as an addiction. And we also know that addiction often has other behavioral and physical health components to it. So we're joining this conference today to learn more about problem gambling as either a novice or an intermediate learner, even as an expert who can always learn more to help others. People who tend toward problem gambling may be risk takers. They may be lonely. They may be self-medicating to ignore pain or trying to fit in with others. And Ohio has strong data that tells us who is problem gambling in Ohio. And we have a clear picture of who these citizens are, and we have enough information to determine what they need most in order to experience treatment and recover from problem gambling. And that is why all of us are here today. As the month progresses, you'll hear a lot about the model efforts being done in Ohio to offer prevention, treatment, and recovery for individuals and families affected by problem gambling. And these programs and practices are not presented in a vacuum. Ohio's service continuum for problem gambling was developed within and among experts in the behavioral healthcare field. So this is evidence-based, healthcare-focused work, and we know that it's having positive impact on the lives of Ohioans. We want you to see young people, adults, and families affected by problem gambling through a whole new lens, a health model, a whole health model, really thinking about their physical, social, emotional, spiritual health as well. And thinking about, has a grandfather passed away and grandma's spending more time playing cards with friends? Is a teenage son losing possessions more often than he used to? How can we complete this whole picture? This conference will open doors while opening our eyes to the fact that we must see people for who they are, not just a gambler, but people who may be depressed or lonely, bored or hurting. And we need to educate that person about the risks of gambling, about how to gamble in a responsible way, and provide clinical care and opportunities to support when they need it. Rarely does someone walk in the doors of a behavioral health agency to get care for problem gambling. In reality, they're usually being seen for another reason, other symptoms or diagnoses, and they may have physical health care issues as well. We are all complex individuals, and your commitment to learn more so that you can support the men and women and families and youth in our communities and each other is very impressive. So whether you're working as part of a community coalition or prevention or treatment certified agency, you have your own shingle out as an independent clinician, you serve as an advocate for the recovery community, or an administrator or focusing on responsible gambling within casinos and racinos in Ohio, we applaud you for being part of this conference and this month of learning. And we urge you to take advantage of as many sessions as possible and join some of the networking and small group discussions where those relationships will matter, not just today, but over time for your continued learning and practice. That will be happening on Thursdays. And this Problem Gambling Awareness Month, we just want to thank all of you for what you're doing to keep Ohio and our citizens safe and healthy. So with that, I'll turn it back over to you, Derek. Welcome, everyone, and I wish you all a great conference.
Thank you, and we'll turn things to Stacy Fronapfel-Hassan.
Thank you, Derek. Thank you, Director Chris. And thank you to everybody that's on this session and was with us this morning, excuse me, for Dr. Deborah Haskins around diversity and inclusion. And she talks such an excellent perspective of that issue. And I think looking at it from all sides is where she shines. Couple notes about where we have been over the last year. When it comes to prevention of problem gambling and promotion of responsible gambling, I want to first and foremost thank Prevention Action Alliance, who has been our primary prevention coordinator partner. We have had 2-year grants in the community for community coalitions, and those coalitions have done focused work with African American groups, with tongue twisting this morning, with faith-based groups, with older adults, with Asian American populations, countless others, really, to look at how gambling has inculcated basically into those different cultures and what it means from a different cultural perspective, which obviously ties very closely into our earlier session. We want to make sure that regardless of where an individual is coming from, as Director Chris mentioned, we are meeting them in that place with prevention of problem gambling and promotional responsible gambling type messages that help them understand, if they are going to gamble, how to gamble responsibly. Some of the activities that have been done by these coalitions include around 300 environmental scans of tobacco and lottery outlets in the Montgomery County area. Um, Lots and lots of educational materials that went out within faith-based groups, within school grab and go lunches. We had very one-on-one almost meetings with Asian Pacific Islander groups and reached folks in just about every conceivable way you can think of. So those community coalition projects have been ongoing and have been extremely vital to the communities. A few of those providers include Summit County Community Partnership, Zeph Center, Mary Haven Recovery Resources, the Akron UMADOP, Wood County Prevention Coalition, and there are others. And we hope to continue that process with new communities over the next year or two. We just hit an end date for the opportunity to apply for $1,000 mini grants for doing social media buying on Facebook. We had a lot of applicants. Those 10 grants have been awarded, but we will continue some education around how to buy social media, what to look for, what to provide the community through social media. And in another year, we're looking at that calendar right now. We hope to do the same thing potentially for Twitter or Instagram or TikTok. How do you buy those ads so that they're the most effective that they can possibly be? And how do you focus your strategies in order to reach the appropriate audience within your community? So just keep that in mind as you see news coming out from Prevention Action Alliance and from Ohio MHAS about these additional opportunities. From the treatment side of the work that we do, Problem Gambling Network of Ohio has been our coordinating partner. Over this past year, they've provided a number of stage 1 trainings, stage 2 trainings, and this spring we'll get into advanced trainings for clinical care for gambling disorder. We are reaching more people than we were reaching with these clinical trainings while in this virtual status. So that's been very gratifying. We know that we need to get as many people as possible to receive the GAMB endorsement if they're with the Chemical Dependency Professionals Board, or to receive the appropriate hours and training in order to be able to add gambling disorder to a scope of practice for people who are social workers, family therapists, clinical psychologists, and so on. So look to pgnohio.org for those trainings. Did I say it right, Derek? I think so. That's okay. You'll see their address everywhere. Look for those trainings as they become available, and please take advantage of them. You'll really never have an easier opportunity to get that education than you will right now. And a few more specifics. In this past year of a pandemic, Ohio was able to screen 62,400 individuals for gambling disorder. And there have been years where we've had more numbers than that. But taking into consideration that behavioral health services obviously were hit hard, healthcare was hit hard. And within the framework that we have had to deal with, we were very pleased with 62,400 individuals getting screened and 873 Ohioans getting treated for gambling disorder over fiscal 2020. In the prevention realm, about 2.5 million Ohioans were reached through prevention. As far as the Before You Bet and Change the Game campaigns are concerned, we had about 77 million campaign impressions. So it's been pretty hard to avoid the campaigns for responsible gambling and promotion of supports around problem gambling and gambling disorder. And the social media side of our outreach included 150,000 click-throughs. So if someone had an ad pop up while they were listening to Pandora or while they were watching TikTok or YouTube, 150,000 times those ads were clicked through. And those were incredibly high rates for social media actions taken across the state. So I will leave it at that. And the next speaker you'll hear from is Executive Director Matt Schuler from the Ohio Casino Control Commission. Thank you.
I'm Matt Schuler, Executive Director of the Ohio Casino Control Commission. And on behalf of the members and staff of the commission, I want to welcome you to 18th Annual Ohio Problem Gambling Conference. The mission of the commission is to ensure the integrity of the industries we regulate, including casino gaming, skill-based amusement machine operations, and fantasy sports contests. We accomplish this mission through four main functions: careful licensing and investigation, robust compliance requirements, enforcement of the law, and through our commitment and efforts to help those at risk of a gambling problem or those with a gambling disorder. Everyone participating in this conference shares this commitment and contributes to it in many, many ways. The ways the commission engage is through our regulatory responsibilities with our licensees, and importantly, through our partnership with the Department of Mental Health and Addiction Services and the Ohio Lottery Commission. We call this collaborative partnership Ohio for Responsible Gambling, or ORG. You will have an opportunity to learn more about ORG in the next session, which will be led by the Commission's own Director of Problem Gambling Services, Amanda Blackford. Again, welcome, thank you, and I hope you enjoy the conference.
Good morning, everyone. So as Matt said, Ohio for Responsible Gambling is an organization of state agencies dedicated to promoting responsible gambling, continuing workforce development for treatment and prevention of gambling disorder, and spreading awareness of problem gambling in Ohio. So we are made up of the Ohio Lottery Commission, Ohio Mental Health and Addiction Services, and the Ohio Casino Control Commission. So you've already heard from Stacy a little bit about the workforce development efforts that ORG is currently supporting. So I'll take this time to discuss the some funding streams and awareness initiatives that we have going on right now. So one really smart thing that the legislature did when contemplating casino law was dedicating 2% of casino tax revenue to the Problem Gambling Fund of Ohio. And this fund is managed by the Department of Mental Health and Addiction Services, but most of it gets disseminated to the local ADAMS boards to fund treatment and prevention services in their board areas. So if you're an agency or a clinician that's doing prevention work or working for treating disordered gambling, keep in mind that those funds are available to you. We have a goal here in Ohio that anyone can get problem gambling treatment for free if needed. So if you have any questions about those funds, you can always contact your local board or contact OMAS with any questions that you may have. So another use of some of those funds is the development of our statewide campaigns, which Stacy had mentioned. We have both the Get Set Before You Bet campaign, which is a general campaign geared towards responsible gambling awareness, along with a youth influencer campaign called Change the Game that speaks to the dangers of youth gambling and the various forms it can take in our communities. So these campaigns have various toolkits that are formed to address different demographics, such as seniors, an African-American toolkit, along with Spanish-speaking populations toolkit, just to name a few. And as Dr. Hashkins really spoke to this morning, in developing these toolkits, we worked with focus groups made up of members of those populations to make sure that our toolkits are culturally proficient and effective. So any of these materials in these toolkits can be made customizable to any of your agencies free of charge. So please feel free to visit both the changethegame.ohio.org or beforeyoubet.org to learn more about the campaigns themselves Also, there's going to be a session later in this conference that speaks to innovative tactics and social media strategies for you and your agencies to use for outreach. Whether you're using our campaigns or not, I think it'll be a great session. And that's March 18th at 1 p.m. So if interested, plug back into that session and feel free to join us and Orgo, our branding company, to learn more about those strategies and those campaigns. So a final point I will touch on is the Ohio Problem Gambling Advisory Board. So this board is made up of our Ohio for Responsible Gambling partners, along with PG&O and treatment and prevention specialists across Ohio. So the goal of this group is to work together to develop strategic plans for addressing problem gambling support and services in Ohio for the years to come. And if interested in being a part of this board, please feel free to reach out to us. In the next few minutes, you'll get the opportunity to hear about just a few of the initiatives and concepts that were initially discussed as part of the advisory board strategic plan and that we've seen go live here in our state, including the statewide voluntary exclusion program and the warm transfer process that we now have from the Ohio Problem Gambling Helpline. So awesome things, and I hope you guys enjoy. But with that, I'll turn you over to our next partner, the Ohio Lottery, and their director, Pat McDonald.
As Executive Director of the Ohio Lottery, I want to thank you for the privilege to join our Ohio for Responsible Gambling partners at this important conference. Although our mission at the lottery is to generate funds for education in Ohio, responsible gambling is and always has been at the core of our organization. Through the years, our social awareness programs have been recognized by industry leaders as the agency was the first lottery in the nation to release public awareness media campaigns in the 80s. Most recently, we expanded our reach by promoting the Ohio Problem Gambling Helpline and an interactive website offering tips and resources to get help. The Lottery Keep It Fun Ohio campaign is designed to educate our players on our games, the odds of playing, and connect problem gamblers with the help they need. Over the course of this conference, you will meet some of the Ohio Lottery management team who play a critical role in our responsible gambling program. You will also hear from the Ohio Lottery Commissioner, Jonathan Hughes, who will share his journey of recovery. At this time, I would like to introduce the Ohio Lottery's Director of Responsible Gambling, Karen Russo, to tell you more about our responsible gambling program. Thank you. As Executive Director.
Thank you, Director. As you can see, the Ohio Lottery is committed to responsible gambling practices. And the primary element of the lottery's social responsibility is to provide entertaining games in a safe manner for our customers that play traditional lottery and video lottery at our racinos throughout the state. The Ohio Lottery continues to be an advocate for responsible gambling by educating our players. And let me tell you, these players are savvy nowadays. They know how to play our games and they want to know more. So by educating them on our games and providing support and awareness for problem gambling, we are making a difference in an effective program. Supporting from the Ohio Lottery is, of course, mandated through the VLT terminals or the racinos, but also the lottery has provided funding and has agreements with the Ohio Department of Mental Health and Addiction Services. The funding from the lottery goes to support regional gambling service centers that provide treatment throughout the state and a shortfall fund to provide additional treatment so that we can all offer free treatment throughout the state of Ohio. Problem gambling workforce development training is provided in part by lottery funding. And of course, we co-sponsor this conference as well as the national conference, and support Problem Gambling Awareness Month, which we are now in. Research funding has always been an important issue, an important stake in the state of Ohio. And to gain that research before the 11 gaming properties opened in the state, and of course, 5 years later in 2017. The lottery provides funding for the Ohio for Responsible Gambling campaigns, Get Set Before You Bet, and Change the Game Ohio. And as Amanda just mentioned, specifically, the at-risk populations, which we are looking at additional prevention campaigns. And of course, you'll hear about the toolkits for the at-risk demographics. As I mentioned, our players are savvy. So in January 2020 last year, the Ohio Lottery Keep It Fun campaign debuted and is resonating with our players. This campaign is designed to inform players on making informed gambling decisions when they play the lottery or at our racinos. Funding to support this campaign includes social media, in-store retailer messaging. We have nearly 10,000 lottery retailers across the state, and paid advertising that encourages individuals to go to the keepitfun.ohio.com site. This site features information about how to play our games, dispels common myths about playing the lottery, and your troll will not bring you luck on playing lottery games, and then gives just practical tips on being a responsible player. There's also a spending calculator that clinicians have used with their clients to just show how much you could gamble over a period of time. And of course, making those direct connections with at-risk or people that may have a gambling problem with the resources and clinicians throughout the state. The Ohio Lottery has kicked off and annually supports Problem Gambling Awareness Month through press release, messaging to all of our retailers, retailer and employee newsletter, all social media outlets and digital marketing. And this year we just expanded our training. The average Problem Gambling 101 training has expanded as well. So the all-employee training really looked in depth into player behaviors and what players, people that gamble might be thinking along the way, so that our employees can understand a little more in depth into the overall problem gambling conversation. This week, we're also having tomorrow customer-facing responsible gambling employee training with scenarios to give our employees a better understanding of how to deal with certain situations and to speak to those players that may give them red flags, and to put them in contact, of course, with the treatment providers if in fact there is a problem. And then the third phase of our training this year is specific to our marketing and advertising team of employees, as well as our vendor partners. So we want to talk about the stigma on problem gambling and the sensitivity, and that words do matter when you're promoting not just game, but responsible gambling messaging. Lastly, I'd like to touch on the helpline for the state of Ohio. The helpline is currently contracted with the Cleveland United Way 211 service. And on average, that helpline gets about 500 calls a month. But during the pandemic, we did see an increase. Last summer. And in June specifically, when the casinos and racinos reopened mid-summer pandemic. So we saw a jump to about 750 calls in the month of June. They are now back down to around 500, but we are keeping an eye on those helpline calls. And kudos to Cleveland United Way for adding 24/7 chat feature to the helpline. We used to have limited hours on that helpline, so now there's 24/7 help available. And then also with the collaborated effort, and of course, Problem Gambling Network of Ohio steering the way, in August of 2020, we introduced or debuted the Ohio Warm Transfer project. So the Ohio Warm Transfer is offering those crisis calls that come into the helpline a direct transfer connection to one of the 9 clinicians that work through Problem Gambling Network of Ohio. So we are looking at expanding the hours of those, because right now the Warm Transfer Project hours are only off hours, nights or weekends. But we see a need, and there is a need to expand the hours on the Warm Transfer. And then the Ohio Voluntary Exclusion Program collaborated with, of course, the Ohio Casino Control Commission. I just want to give you a brief update. We have, since the new program, combined program began, where someone can exclude themselves for 1 year, 5 year, or lifetime. That began on March 1st, 2019. We have about 1,900 individuals currently enrolled in that program. And of course, there are still what we call legacy voluntary excluded individuals on either the casino control list or the individual state racino list. But 65% of those individuals are male. Nearly half are 21 to 40 years of age. It's a younger demographic taking advantage of the program. 22% are at 41 to 55 years of age, and 12% are over 60 years of age. 1 year is, of course, the most popular time frame for an exclusion, but then lifetime is next. And you can opt out of a lifetime exclusion after the 5-year minimum through a process. So, and then the ethnicity, we're keeping a very close eye on. 55% of those enrolled in the exclusion program are Caucasian, but 30.5% are African American. Almost 6% are of Asian demographic and populations, 3.5% Arabic, 2.5% Latino. We also track American Indian, Pacific Islander, and we are looking right now at translating those applications for the program into Mandarin, Spanish, and Arabic. We have 13 other states of individuals enrolled as far as California. And there are 300 individuals that have removed themselves, 370 individuals have removed themselves since the program began and their 1-year agreement term had expired. It is not an automatic removal. There is a removal application, and they must go through the process in order to be removed from the program. I will make note that we did have a number of people that did remove themselves last June when they could go on property after their 1-year term expired, only to sign up again. So we're keeping our eye on that as well. That's a recap of all of our programs, I think. So take it away, Derek. Thank you.
Thank you, Karen. And often in Ohio, we're referred to nationally as the Ohio model. And you can see from our representatives from Ohio for Responsible Gambling, Director Chris with the Casino Control, or with the Mental Health and Addiction Services, and Director McDonald with Lottery Commission, and Director Schuler with the Casino Control Commission, that we have engagement not only at what we would call the ground level with all of our boots on the ground, so to speak, but also at the top levels as well. So with that, we'll see if there's any additional questions that you have. We're a little bit at time right now, but the one question that I did see in the Q&A was, where can I get the spending calculator? And Bill asked that question, and I dropped it in the chat there, so you can refer to it there. So thank you again for everyone who participated today, and special thanks to Amanda, Karen, and Stacy, who are often the ones that get my calls late at night and whenever I've got a question, and they're always quick to respond. So thanks to them and the wonderful infrastructure that we have in Ohio.